name is Tara Newcomb, and I'm a genetic counselor. I've worked with Dr. Catherine Swoboda for the past 4 years, and so have been involved with AHC since then. And my role is really helping with obtaining information from families and explaining genetic testing results. I have met with families at the past 2 conferences, face-to-face, to go over individual results, and then I also spend a lot of time on the phone with families, answering questions and discussing genetic testing over the phone. AHC has definitely been one of the most unique disorders I've worked with. We see a lot of rare disorders in our clinic, but just very interesting. I don't know anything really else like it. The families are all wonderful. They're all very knowledgeable, and the kids are just very pure and friendly and just lovable. So it has been a real joy to get to know the families and work with their kids. So the disease is one where it can start as soon as birth, and the children have episodes of either weakness or dystonia. That can be one side, they can be the other side, or both sides. Some children have seizures, some children have permanent neurologic symptoms between episodes. They tend to be behind in school, developmental delay, and have recovery of episodes with sleep. So the most distinctive feature is really the alternating floppy episodes that recover after sleep. Each kid is so different. I have seen several who do have attacks. Some of them, they're just like limp noodles, and they just seem really lethargic and sleepy. And others, you can definitely tell that they are in pain and they're crying and uncomfortable. And I don't blame them. It looks very painful to be stuck in that position. It's like a tense, twisting motion where if they want to reach out and grab something, they can't. Their brain will say, get that cup, and their arm is just stuck. And so it's almost like continuous muscle spasm, like if you were to have a Charlie horse is what I think, just constantly for hours on end. I think there's a lot of exciting things that are happening in AHC. I think we will learn more about what this ATP1A3 does and how it functions, and hopefully why a problem in this particular gene or channel causes these weird fluctuating episodes. I think we'll get a better understanding of the basic mechanism for that, and I think we'll be able to target treatments better. I think technology and science is moving in a way that in 5 years, this disorder is going to look much different. The conference will be much more about what we can do rather than let's describe and discuss what it is. And I think eventually even things like gene therapy are going to be an actual reality for these kids. In the past, it's been extremely complicated. Their kids go through years of testing that is negative, but we're getting to a point now that we have a gene that if you have a physician that recognizes it, then it's a really simple genetic test that takes 2 months, 3 months, and you have an answer. So I think our goal as a community and as care providers is to educate others about what to look for and when do you order that simple test, so that we can go from the past where it was let's do spinal taps and imaging and muscle biopsies to we have a kid who has alternating floppy episodes, let's test for AHC with ATP1A3. AHC is a unique disorder in that it is so rare, and so we have patients from multiple countries, different continents, and different drugs are available in different areas. And part of the problem is there's so few drugs or medications that have been even somewhat effective in treating the episodes. So it has made it a real challenge to help treat these patients. It's also difficult because most of the drugs we're using they're being used to treat something after it's occurred. So we have rescue medications to help get kids out of episodes, but we don't have any good medications to help prevent the episodes from happening. And right now most are on seizure medications when it's not really a seizure, but these episodic events are treated a lot like seizure. I talked to a family that we have a new confirmed mutation. It's usually a relief that, okay, now we know, we can stop looking. But then, okay, what do we do next is a little bit more complicated. Right now, I can't tell them, you have a mutation, go buy this drug from the pharmacy. So it's a lot of keep doing what you're doing, keep doing the physical therapy. We don't have to do any more extensive or invasive testing, which families usually like to hear, and then, stay in touch with the foundation because the latest and greatest, they're going to be the ones really disseminating that information. So to be involved with the community, because to be honest, usually other parents of children with AHC know more about what works and what doesn't work for their child than I do. And so that community is, I think, the most important thing for these families to be able to talk to each other and say, okay, I tried this and this is what happened, and, to give that feedback to each other. I do. I think cure is a loaded word, and it's very easy to get caught up in that, we need to cure this disease, and cancer is a really common disease that we've been trying to cure for a very long time. But I think it is possible it's definitely possible to treat better than what we currently have. And I think having a way to really effectively manage and prevent episodes, I think is definitely within reach. Yeah, I think the more people we can get working together in unity, the better it's going to be for families. So it has to be more people kind of as a big unit working at once. We can't have one person doing their own thing while another person's doing their own thing, but a little bit differently, and they end up kind of repeating or doing too much of the same. But I think getting a big community of physicians together and really thinking about this disease is more brain power is always better.